This episode of HIPcast is brought to you by FairCode. Are you looking to maximize your hospital's revenue and streamline patient documentation? Introducing FairCode, your trusted partner in DRG reimbursement optimization. FairCode's 100% board-certified physicians collaborate seamlessly with your coding, CDI, and medical teams to conduct lightning-fast chart reviews pre-bill and post-discharge to ensure accurate reimbursement. Only 10 to 15% of the chart's FairCode reviews require changes, yet their recommendations result in a significant boost to a health system's cash flow. Are you worried about risk? Try FairCode's 13-week trial. If they can't pay for their services, they'll keep reviewing charts until they do. And by the way, historically, FairCode's 13-week trial leads to ongoing partnership with a remarkable 3-to-1 hard dollar ROI. Don't miss out on the opportunity to enhance your reimbursements. For more information about FairCode and how you can experience the maximum in healthcare revenue optimization, contact Steve Hansen at shansen@faircode.com or by phone 61.
Awesome. Today we have, an old friend. Not that you're old, Kyle, just that you are a longtime friend of THIMA, which this podcast is in support of. So I'm going to read Kyle's biography just to level set for the audience who maybe don't know Kyle or who knew him in Tennessee and haven't really been able to keep up with what he's doing. So Kyle McElroy serves as the Vice President of Health Information Management Operations for Tenet Healthcare, where he oversees all functions pertaining to medical record processing, hospital coding, data capture, clinical documentation integrity, and HIM strategic initiatives. In addition to these responsibilities, he also oversees the Tenet Physician Advisor Program and Clinical Denial Team. Kyle joined Tenet in July of 2020. COVID win. He provides direction and support in operational areas such as patient portal, information governance, regulatory compliance, mid-revenue cycle functions, revenue optimization, and electronic record standards. Prior to joining Tenet, he served in a similar capacity at Steward Healthcare and ISS Healthcare from 2007 to July of 2020. He was the Health Information Management Director and Facility Privacy Officer at North Vista Hospital in Las Vegas from 2005 to 2007, which was an ISS hospital. Excuse me. Prior to joining ISS in 2005, Kyle served as HIM Operations Manager at Central Florida Regional Hospital, an HCA facility in Sanford, Florida. He held various roles with the department over the 3-year period, including inpatient and outpatient coding. Kyle holds a master's degree from the University of Central Florida in Health Services Administration and also a bachelor's degree from the University in Health Information Management. He's a registered health information administrator, what we affectionately call an RHIA, and previously certified as an EMT in Florida. He previously served as the president of the Tennessee Health Information Management Association and the THIMA Foundation, which is a 501c3 organization. He has served on various committees, such as an appointed member of AHIMA's Privacy and Security Practice Council in 2011, and a former member of the Health Information Management Reimagined HIMR Committee. Kyle has been a guest speaker at over 50 regional, state, and national meetings over the past 20 years. Kyle, welcome. I will say, generally, Seth and I try to get really accomplished professionals to speak to things. You should go get some work. You should go get some experience.
I should.
Thank you so much for joining us. We really appreciate it. Seth and I, being out of health information operations for quite a long time, doing different things, we have a lot to learn from you today.
That's right. That's absolutely right. And it's interesting to hear your background, Kyle, and we do have a prep document that we go through for our listeners. So there are questions that our guests are somewhat prepared for, and then there are questions like the one I'm about to throw at him that we didn't even talk about. So I'm curious about one thing I like to ask our guests, especially our health information professional guests, are how you got into HIM. How did you see that this profession when you were at UCF? and decided that this was the career journey for you?
Sure. Well, first, Seth and Shannon, thanks for having me on the show. We're really glad to support the organization here. A couple things. I would say that to get started in HIM profession, I really started off on the clinical side of healthcare, and then it just sort of evolved and ultimately found the opportunity within UCF to join the RHIA program. So it was a little bit accidental, but then you kind of jumped into it, and found that there was a degree there, and joined, and it was a great opportunity to go from there.
So you started as an EMT. That was the clinical path. Were you thinking nursing at all, or pre-med, or were you like, oh, this is not my thing?
I think like a lot of folks, you start out in some aspect of clinical. You want to get into doing something. My father was a medic in the Air Force, so it was always kind of a thought of healthcare, and try to get into what aspect of it. But what I think a lot of HIM professionals don't realize is that there's a business side to healthcare.
Yeah.
And so I think that's really where HIM has a unique cross sector, because you start off on the clinical side and kind of understand, okay, well, how to treat patients, what's the care delivery process, and then from there you start to learn about other aspects of healthcare that you would have no idea you would have how to get into.
I think that's a core benefit or unique benefit that a health information professional has, is the understanding of the disease process. We're not necessarily, to train to the level of a clinician to diagnose or treat, but we understand disease processes. But at the same time, we understand the business side of healthcare, and then to put those together and managing information from the point of creation to retention periods is a unique skill set that we have. And that leads you into the HIM operations world, right, Kyle? And you're managing large scale operations for a health information department across, Tenet's got 70 hospitals at this point, all across the country. So that's a major operation that you're overseeing. What does that look like today? And then as you look across the horizon for the future, how do things like AI and the ever-changing digital world affect your business in HIM?
Sure. Yeah, just one kind of transitional comment going from, how to get into HIM into the AI world. I think where HIM professionals, really what really helps them, and maybe an EMT to some degree, but more HIM, is you learn how a hospital operates. You understand the departments, you understand the data flow, you understand how information migrates from radiology to the medical record, you understand the order process. So, I think, from a foundational standpoint, we often don't think about that, in terms of, sort of a knowledge that you pick up while you're working in this field that most people wouldn't understand, or if they're not working, directly in a health system environment, they generally understand, but they don't understand the details and exactly how it happens. So, then when you think ahead to AI technologies, I think this is an exciting time, just like in most industries. I think we're going to see a lot more AI technology entering in the health information environment. I think specifically with coding, clinical documentation areas. I think you'll also see HIM record processing areas, as we develop more specific algorithms. I think there's opportunities to improve the quality assurance on the AI results. So I think it's an exciting time for HIM professionals to be a part of that development of AI, really to do things more efficiently, getting more real-time trusted information into the hands of the caregivers and to the patients.
Yeah, I love that.
Though. I'm curious about the fear aspect of it. Like the exciting piece is there, but there's also got to be some fear.
Sure. And I think that, again, that's really, I think, goes to HIM professionals, right? We can all point to the flaws in technology, there's a lot of things in my everyday house that I don't know how to use very well, or I don't use it to its maximum capacity. And so I think, if you think about it just from an elementary standpoint, I think that's where HIM professionals are at the front lines, help, refine those details to make it right. Develop the right rule sets. Be really a part of the solution. In the future. I mean, the future is here. It's coming. It's just a matter of, are we on board, and do we develop the right framework with that expertise that we have inherently, embedded into our knowledge base.
Yeah, that's interesting, Kyle. I agree with you 100%. AI should increase our efficiency. And I mean, really, we could get to DNFB a lot faster, right? We really could if we have AI helping complete charts. And then we're helping as health information professionals build those algorithms, or at least teach it to be better, but then also governing that output, right? Like one of the things that I'm most excited about is everybody talks about policy and procedure up front, but not so much on the outputs of that data. Everybody's talking about building AI that's responsible and that it's not biased and all those things. But from the backside of that, health information documentation that's generated with AI has to be governed, and it should be governed by health information professionals. So, I completely agree. And I also think, to your point about health information professionals, just really grasping this and not having the fear, or not letting the fear overcome you. We actually have the opportunity to help create that trusted information from that policy ground up perspective with AI. What would you say? And I'm going to throw a zinger at you, and I also have another one for later if we get to it. But what would you say to an existing health information professional in one of your departments, one of your hospitals? If they come to you and have concerns, where do you tell them to go and learn the skills that they need to think about with AI? How do you help them? How do you help develop those folks?
Yeah, great question. The part of it, I think, at first is, folks trying to grasp the concept that it is here, and then that will force them to further develop their skills. But, I think the demands for coders and HIM professionals in particular, in data abstraction resources, continue to increase. A good example of this is just the most recent ICD-10 code additions around social determinants of health. In many cases, that information is documented in case management notes, social worker notes. This is really important information that's helping to, profile, different aspects of the patient care process, helps organizations understand, how they can improve discharge planning and other needs of their patients.
Yes.
And so, and a lot of times the needs of these abstraction are far beyond the ability of a coder to capture everything, particularly in these areas that are not always physician documented notes, like, again, the case management social worker notes. So, I think the needs of the data sets are, are becoming more specific, and, coders just don't have the time to review a record an hour, or, less than 1 hour. I mean, there's business operations that need to occur, but, for the professional themselves, I think just understanding the more broad range of AI technology, we are in a career of constant learning, right?
Yep.
We're always evolving. And so I think the bigger picture of all of this is a lifelong of learning will help, continue to open up that next door for the HIM professional. And this is just one more example of that. Don't necessarily think about AI in healthcare, but just look at AI in general, and become knowledgeable in that. And then there's companies out there that are, getting into this space right now. I do think we'll have much larger, maybe non-traditional healthcare companies entering into this space.
Oh, yeah.
That have that type of technology already refined in other areas of non-healthcare that may help accelerate the penetration of AI and
they'll need HI professionals to operate in those environments to help them understand the healthcare side of that engine. And, I think I'm the one that always brings up fear in all of our podcasts, but, I think for our audience, I know I'm so risk adverse. It's not funny, but for our audience, I think that what Kyle mentioned there is that there is so much data hitting the coders, the clinicians. There's so much data hitting a health information professional that AI is not the robot that replaces your job, right?
Yeah.
That's not what AI does. AI is really good at synthesizing data into meaningful patterns. And that's where I think the value comes to be for the health information professional to have AI as a tool, not a replacement, but a tool to understand how to pull all this data into a synthesized approach.
Yeah, very good. So Kyle, let's talk about a couple of things. So HIM consolidation, HIM operations consolidation across the industry, but also more consistent remote work since March of 2020. How can the health information professional stay engaged and also continue to show their relevance with that decentralized or with that centralized and also remote kind of combination? How can those health information professionals stay, I guess, known by the organizations? I don't want to say relevant because I believe we're relevant as long as health information exists, but that's kind of what I'm asking.
Yeah, I mean, I think HIM professionals play a critical position within the revenue cycle process. I think folks can stay, more relevant and try different things. Try initiatives to own and improve different aspects of revenue cycle. I think every health system is challenged with whether turnover, open positions, and it's like HIM has its piece, but I think where in my career, it's learning how do those other areas touch
Yeah.
HIM, and then how can I help, figure out, better ways to improve our revenue cycle process or our healthcare delivery process. Is there a certain report that I can get to, our nursing teams that will help with discharging patients timely?
Mm-hmm.
Is there something different that we can do? Is there an area that we struggle with? In the RCM side, in the revenue cycle process, that because you understand the coding side, you understand the medical record, that you can help, the organization, become better at that function. So, I think, being relevant is just really expanding upon your skill sets. I don't think HIM is just that sliver anymore.
Yeah.
I mean, I think you'll have HIM professionals that will lead larger RCM, operations in the future. You have a fundamental skill set. You've entered the market with a technical degree. You have a technical job. You understand how these pieces come together. The question is why not? Why not be a more global leader of RCM services, or
Mm-hmm.
work your way into adding one more aspect of that department? Maybe you can help out with patient access areas. Is there areas that you can help with cleaning up the insurance master, for example, in ways that will help more accurate selection by the folks that are working face to face with the patient. So I think there's unique skill sets that you have here that you can become more and more, and I agree with you, Shannon, relevance is probably not the right word, but you can really increase your value to the organization by learning these different aspects.
Yeah, that's really good. I do want to ask you a question, and this is just coming to me as you're talking through that, because I remember health information or medical records was in the basement, right? And then we're out of the basement, and then we're into this, and we're moving around in different places and showing up as more data is generated, we move into these different places. But one of the biggest challenges that I remember from working in a hospital setting was that health information management department is not a revenue producing department. We're more of cost avoidance, right? We're the risk mitigation. We're
fearful ones.
Yes, some of us are chickens, some of us are not. But the point is to say that, I understand we're not revenue producing necessarily, but we are cost avoidance. We are making sure that claims get coded so that they can get billed, and we're making sure that that medical record is complete from a compliance standpoint. Do you see a way for health information to become a revenue producing department? And I know some people have a revenue generation from release of information for attorneys and things like that, but that's not a significant, consistent revenue line. So what do you think about revenue producing from an HIM standpoint?
Yeah, also great question, Shannon. We still, that question is often posed. A lot of times you'll have folks that, whether it be chief operating officers, those are kind of managing, labor and, holidays come, you want to flex down, or close departments and other things. At the end of the day, the lifeblood of the revenue cycle process still remains the coding operations, and even to some extent beyond that, just the CDI platform. Making sure that coding and CDI are so closely aligned. I'm a firm believer that the closer that CDI and coding are, the better outputs you're going to get with the right documentation.
Absolutely.
And so, it's really just, in my view, it's just, just changing that narrative. I mean, you need to, maximize the time that these folks are working. They're very important to the organization for volume capture, for net revenue recognition, and all the things that are associated with it. So I think organizations that are more mature in their revenue cycle views, will understand that. As long as there's other labor tools available to kind of measure volume to FTEs worked and that type of thing. So I mean, there's always going to be some element to it, but at least I've been fortunate to, just to be able to have those conversations with folks in the past. And I think ultimately, in some respects, you're also educating, right? The healthcare world folks come from all different educational backgrounds, many of which are not healthcare centered education. So they may come from an accounting background or something. And so in a lot of respects, you're also educating about, how your operation impacts the overall hospital, and maybe ways they didn't think about it. They just think about, well, the record's electronic. So, why do we need this department open? Well, all these other things will happen. And what if you get a duplicate medical record? Who are you going to call? To get merged.
It's not the Ghostbusters.
It's not the Ghostbusters.
It's going to be an HIA professional.
Yes.
It's interesting you mentioned the COO there and the C-suite executives, because it is something that HIM professionals or HI professionals have often mentioned in professional events, professional association events, about getting a seat at the table and getting executive visibility. What advice would you give to the HI professional out there that can see the processes from beginning to end, but is struggling to get to that C-suite to educate them on the value that the HI professional brings, the value that the HI department brings within an organization, as we sit today and kind of as we head towards the future, as some of the tech-enabled items that you've mentioned?
Sure. HIM field, like many aspects of different career paths, are constantly evolving, and that is a question that comes up, oftentimes, especially where, some folks may feel they have reached a ceiling in their career or within their healthcare organization. I think the simple answer is, you just have to pull the chair up to the table. You have to do it yourself. Nobody ever saved a seat with my name card on it. It's like, you gotta be able to learn and demonstrate value to the organization in different ways. There's ways that you can increase adoption of technology. What about increasing digital capture of clinical documentation to eliminate paper forms? Some of these are kind of core fundamentals, but if you're able to really put a action plan and put a framework around initiatives, I feel like our roles are also project managers, right? We are we're taking problems, and then we're building a plan around it, and then we're fixing it. And so I think the more times that you're able to kind of bring those together and then demonstrate value for the organization, and sometimes it's just doing the things that nobody else wanted to do, picking up the projects that are out there. And, I think that generates, especially over time, generates respect for organizational impact, and then you'll start finding yourself getting more questions, well, what do you think about this, or how about this? And then that's when you really start to see where your professional expertise is growing. And you as a professional are growing also, because, you got to take a little bit of risks, you just got to, so many times I just did a project and, I don't know. I've never done it before, so hope it goes well. You could overanalyze something and be in a paralysis standpoint. You got to just take a project, something that's not working good, try your very best at it, and then you start building those wins. And I think so. I think that allows you to pull that chair up to the table. And I think that would be the advice I'd give HM.
I love how you started that, Kyle, because Seth, you basically cannot be a chicken. He started it and ended it with pull your chair up at the table and don't be afraid to do so. I love that he did that. Kyle, I do want to go back to something you talked about early, which I think is incredibly important. And I think we have to, as a professional, keep developing. One of the things you mentioned in the beginning was we have a very technical degree, right? We have a health information management degree, and we understand revenue cycle from our standpoint, but not necessarily the business operations of the organization. And I think that is a key component of helping us be at that executive level, right? To say, I understand these operations in health information management. I understand how to keep us out of prison. I understand how to get us the most appropriately paid, whether that's up or down. I understand how to communicate with the clinical staff. I understand the electronic digital format of things, but also from a business standpoint, we have to be open to learning that, right? As a health information professional, a business degree coupled with a health information management degree is incredible, right? It's really a really good combination. But maybe if somebody doesn't have the opportunity to do the formal training, right? They don't have the money or the time to go back and do formal. Would you recommend that they just do some online business classes just to understand basics of business?
Yeah, I mean, I think probably one of the areas that I've personally grown the most by self-learning is understanding how a CFO thinks, or what questions they're asking, understanding balance sheets, financial statements, things of that nature. Because a lot of times your coding then plays into that, and then then they'll have questions, and you're trying to think about, well, I'm seeing this, why are you not seeing this? Or if you are seeing it, where's the deviation? So, I think, any ways you could just better understand, financial reporting, I think is really important, both for your own departments, as you talk about labor and salaries, wages, benefits, always referred to as SWB, and just some of those sort of terms. I think it's just educating yourself on some of the terms that are used by controllers, CFOs, financial professionals, and it helps you reduce the knowledge gaps that you have inherently that are between your two areas. And I think if you can kind of translate, discussions, between them, then, I think that's helpful. And I don't think it's a formal, degree path, or it could be, but, I just think, there's a lot of publicly traded companies out there, both healthcare and non-healthcare. They have quarterly earnings calls,
Right.
and, and listen to things, and,
Yeah.
you might have to listen to 10 of them before you make a connection on certain
Yeah.
points. But, you start hearing the terminology like EBITDA and some of these different things, and then you start trying to understand that. So for me personally, and I think for anybody that's working in the HIM space, that and especially the senior level, like that's an important gap to close.
Yeah. It is for sure. And I wonder, I was thinking as you were talking about learning to think like a CFO, I was thinking that's what's different about you. It's not the Fu Manchu. You've grown, sir. I love it. I do have one final question for you, but without sharing anything proprietary, I wonder if you could talk about any strategic initiatives you have for your organization from a health information standpoint for the 2024 year. Is there anything around AI or other things? Again, not sharing anything proprietary.
Sure. Yeah. I mean, Tenet Healthcare is a fantastic industry leading healthcare system, offers a lot of different options, both acute care hospitals, about 62 acute care hospitals. We have our USPI platform. It's the largest operator of outpatient surgery centers in the United States. We also have our Conifer Health Solutions. It's an RCM company. And so, a lot of different moving parts. It's really a multi-dimensional health system. As we talk about AI, I think looking ahead to next year is, really understanding what the technology can offer. And
Hmm.
to kind of tie back into that previous question about, thinking like a CFO, challenge yourself. Like, what question or what problem are you trying to solve? There's a lot of different vendors that are entering and emerging in this space. But, I always ask myself, like, am I going to reduce my cost? If I still have to touch these accounts
Hmm.
to automate some aspect of outpatient technology, how much am I really saving, in terms of cost? So I think about just being critically minded about, what type of problem you're solving rather than just picking something and then going with it.
Yeah.
Really try to understand the some people call it a pro forma, but like your business plan. If you implement said technology, will it reduce your FTEs? Will it increase productivity in a meaningful way? Will it lower costs? Will it improve outputs? And so I think that was a challenge, in some respects with computer assisted coding. Everybody kind of jumped on this because we were, faced with ICD-10, and there were some other challenges on there. And, I think, you try to tie things back to return on investment. There are some aspects of that. I think, maybe we fell short, as an industry. Maybe there's not as much savings or improvements on a net basis as one might think. So I think about AI, or, for our organization, we haven't been the first one to pick a technology and implement. There are other health systems that have. We are still in a sort of evaluation stage, I would
Okay.
say. Those are some things that we're doing. One of the things I am excited about that we've done a lot with this year is really further developing our global business center in Manila, Philippines. This is an area
Nice.
where we have our own FTEs. These are Tenet and Conifer employees, and we're really able to, it's in some cases pull back from outsourced solutions and actually
That's
have
awesome.
more employees that are working for us as a company and really share best practices. And so we really
Awesome.
have that 24/7 operation that we have some other ways that we can expand upon. So I think in some respects we're trying to think about different strategies. If the technology will improve outputs, how will it? And just kind of look at those couple of areas. But
All right, that's exciting. I think of AI with coding, computer assisted or autonomous coding, and then I think about is anybody running their computer assisted coding or their autonomous coding in parallel with ICD-10 and ICD-11, because there are going to be a lot of challenges with ICD-11 and AI because there's new codes, new terminology. It's electronic. It overrides your coding sometimes, so it's going to be kind of crazy. Kyle, I feel so much smarter already just listening to you answer these hard questions. Thank you so much for joining us today.
I'm really glad to be here on this on my first podcast with you both. I think this is a great thing that you all put together here, and thank you for having me.
All
For
right.
sure.
And we'd also want to thank our sponsor today, which is Faircode. Are you looking to maximize your hospital's revenue and streamline patient documentation? Introducing Faircode, your trusted partner in DRG reimbursement optimization. Faircode's 100% board certified physicians collaborate seamlessly with your coding, CDI, and medical teams to conduct lightning fast chart reviews, pre-bill, and post-discharge to ensure accurate reimbursement. Only 10 to 15% of the chart's Faircode reviews require changes, yet their recommendations result in a significant boost to a health system's cash flow. Worried about risk? Try Faircode's 13-week trial. If they can't pay for their services, they'll keep reviewing charts until they do. And by the way, historically, Faircode's 13-week trial leads to ongoing partnership with a remarkable 3-to-1 hard dollar ROI. Don't miss out on the opportunity to enhance your reimbursements. For more information about Faircode and how you can experience the maximum in healthcare revenue optimization, contact Steve Hansen at shansen@faircode.com or by phone 615-600-2166. Shannon, until
All
next
right.
time, my friend.
See you next time. Thank you.